Good afternoon. Apologies for being a little bit late. Thank you for being here. Today really is a chance to talk yet again about our COVID-19 situation, and in particular what we're seeing in the rest of the country and here regarding the Omicron variant and the implementation of additional public health measures and recommendations so we can try to protect ourselves and our health system against COVID-19 and its variants. I'd like to start by giving a recap of the last month. Since mid-November, we've had 94 cases, or 22% of our total cases since the beginning of the pandemic. 16% have traveled within Canada, 21% have traveled internationally, 57% were contacts of cases, the majority of which were travel-related. 5% did not have a link to travel or a positive case. 17% were under the age of 12 years, and 16% of these cases were over the age of 60. On average, each case had 9 close contacts, and that range was quite wide, from really no close contacts up to over 100. The rolling average daily case count for the last 24 days is over 2 cases per day. This is the highest amount of sustained COVID-19 activity we have experienced since the pandemic began. We've had outbreaks in 5 workplaces, 2 schools, 1 group home, and other cases have impacted 2 early learning childcare centers and numerous sports teams. The last few weeks have been challenging for those involved in the COVID-19 response. In particular, our public health and testing capacity are under significant strain. We are still able to do contact tracing. However, we are considering alternatives to identify close and casual contacts if the current levels of transmission continue. Our testing clinic and provincial laboratory staff have been working tirelessly to meet the demand for testing. There are 3 new cases of COVID-19 to report in PEI today, bringing our total number of active cases to 36 and 423 since the pandemic began. 2 of the cases are travel-related, and 1 is a close contact of a previous case. 1 is under the age of 12, 1 is in their 30s, and 1 is in their 60s. Contact tracing is complete, and all are self-isolating. We have received confirmation from the National Microbiology Lab in Winnipeg that we have at least 1 case of the Omicron variant in PEI. This is one of the cases that is associated with the outbreak at St. FX University. It was not a surprise to learn the genetic sequencing was that of Omicron, and I expect more of our cases will be confirmed as this variant in the coming days. We are seeing COVID-19 spread faster than ever before, which is consistent with Omicron. It is still early days for this variant, and there is much that we do not know. Omicron has the highest number of novel mutations compared to other variants. Some of these mutations have been associated with immune escape and transmissibility. We do not yet know the significance of the mutations in relation to vaccine effectiveness. While the Delta variant continues to be the dominant strain, Omicron is spreading quickly across the country. In Ontario, they are predicting that Omicron will be responsible for all new cases by the end of this month. They are seeing a doubling of Omicron cases every 3 days. Omicron is estimated to be 3 times more transmissible, and it spreads especially quickly within households. In terms of severity, it is not yet known if Omicron leads to more severe illness. Initially, it appears as if the virus does not cause more severe illness, but because of the speed of transmission, we know there will be more cases with this variant. A larger number of people with COVID-19 will impact the public health and the healthcare system. We know the more cases we have, the more likely it is that some people will have complications and some more serious illness. Studies are underway to determine the effectiveness of vaccine against Omicron. It also appears that individuals can get reinfected with Omicron after having another strain of COVID-19. Omicron has the ability to evade immunity from previous infections. The best thing we can all do to protect ourselves and others from COVID-19 and its variants, including Omicron, is to be fully vaccinated. And if you are eligible to be immunized or eligible for a booster, please book an appointment online or call the vaccine booking line. And I know we have a high rate of vaccination, which has protected us from high rates of serious illness and infection through the Delta wave, and we will be hoping that it does the same through the Omicron variant as well. I will note that it looks like there's 7,500 people in PEI who are eligible for a booster and have not yet received one. So I really encourage those who are eligible to book their appointment. We will learn more about Omicron in the next few weeks. It is known that vaccination in combination with public health measures and individual practices continue to help control the spread of this virus, including Omicron and the current predominant Delta variant. We know that both Nova Scotia and New Brunswick, as well as many other provinces, have confirmed cases of Omicron. The situation with the variant is evolving, and it is important that we continue to monitor the emerging science and epidemiology associated with it. Our risk assessment will need to change as new information becomes available. As more cases of Omicron are found in Canada and around the world, the more we are at risk of importation of this variant. Some have described this almost like a tidal wave or tsunami, and it is coming quickly. And we really are going to try to do everything we can to protect those who are vulnerable and also protect our healthcare system. So the situation is concerning and worrisome. Last Friday at the briefing, I stressed the importance of limiting travel, following the post-travel testing regimen, and assessing your own risk when deciding to attend personal gatherings with people outside your household. And now is the time to take additional steps to limit importation and spread of Omicron. Now is the time to add every layer of protection we can to reduce our individual and collective risk. Effective at 8 a.m. on Friday, December 17th, until early January, the following temporary measures will be in place. In terms of travel, we will continue with our strong border measures that include testing and screening at points of entry. Everyone traveling to PEI will be asked to wait to get their result of their point of entry test about 2 hours before joining their family or going to public places. Individuals traveling to PEI with a PEI pass are strongly recommended to take a test on day 4 and are now asked to follow modified isolation during those first 4 days. This means not attending large gatherings, including large personal gatherings, attending church or visiting in long-term care, community care, or others who live in congregate living settings, and also should avoid visiting with individuals who are immune compromised or those with underlying medical conditions or elderly individuals. Masks will continue to be required in indoor public places. Wear a medical grade or 3-layer mask and wear it properly, making sure it fits well and covers your nose and mouth. We should wear our properly fitting mask as much as possible to decrease the risk of exposure. Masks can only be removed when actively eating or drinking. Masks can no longer be removed when seated at organized gatherings such as worship services or concerts. Masks are to be worn in workplaces where physical distancing cannot be maintained. Masks should be worn in outdoor spaces when you are in close contact with people from outside your household. The limit for personal gatherings is reduced to a maximum of 20 people as a means to reduce transmission. This limit includes people in your household. It is preferable to keep personal gatherings to less than 20 people, as smaller gatherings are lower risk. Keep your personal gatherings to 20 or less. And I know Dr. Strang has talked about 20 is plenty, and in New Brunswick, Dr. Russell, the steady 20. And so we are consistent in terms of that number. Worship services can continue with physical distancing between people of different households. Masks are to be worn at all times, including when seated and when singing. Long-term care and community care residents must be fully vaccinated, including a third dose booster, to go out on community visits. Visitors to long-term care, community care, or acute care facilities should continue to wear medical-grade masks at all times when visiting and avoid visiting if they are not feeling well. Individuals who traveled within Canada are not permitted to visit in long-term care or community care or acute care facilities until they've had at least 2 negative tests, including a test on day 4. For staff of long-term care, community care, and acute care settings, as well as volunteers in these settings, who traveled within Canada need at least 1 negative test prior to reporting to work and will be required to strictly adhere to the medical mask policy and follow an enhanced testing schedule. Ideally, and if possible, staff and volunteers should not return to work until a second negative test on day 4. And our office will be communicating more details regarding testing and reinforce the importance of mask requirements to operators of long-term care and community care prior to Friday. International travelers, including staff, volunteers, and visitors who traveled internationally are unable to enter an acute care or long-term care community care setting in PEI until they've had 3 negative tests. And on days 0, 4, and 8, individuals must complete all federal quarantine requirements. Schools will remain open for the next 3 days prior to the Christmas break, adhering to the current measures, including cohorting and masking. We will know more about the potential impact of Omicron in the next 3 weeks, and will make a recommendation in early January regarding the reopening of school in 2022 or a possible delay. There will be no travel to or from PEI for people to participate in organized recreational activities, including sports, arts, and culture events, regardless of age. The Maritime Junior Hockey League and the Quebec Major Junior League are exempt from these travel restrictions for the time being. There will be no tournaments of any sort in PEI, regardless of the age of participants. However, regular practices and league games can occur involving a maximum of 50 participants in one day. Every business, eating establishment, and organization should take every reasonable step to ensure a minimum of 6 feet between patrons of different households. Individual patrons should choose locations where they can be sure of being seated 6 feet from others outside their household or small social circle. There must be no more than 20 people at a table in a restaurant, and no standing receptions where food and drink is served. People must be seated when consuming food or drink. Close activities such as dancing at a wedding can occur in cohorts of 50, provided masks are worn at all times. We are entering the next phase of this pandemic from a position of strength. We have a very high rate of full vaccination. We have excellent testing capacity and one of the highest rates of testing per capita in Canada. We have the tightest border measures, including active screening and testing at the points of entry in the country. And importantly, Islanders have demonstrated their willingness to follow public health measures and do their best to protect themselves and others from COVID-19. And whether that's with isolation protocols, wearing masks, getting tested, staying home when sick, or stepping up to be vaccinated. We are in a good position with the lowest rate of COVID-19 in terms of cumulative cases of any jurisdiction in Canada, in large part due to the resilience and cooperation of the residents of PEI. Adjusting to Omicron will take work and effort, and it couldn't happen, it doesn't seem at a worse time as we prepare to gather for the holidays. But I know we will adjust, and we will get through this by focusing on restricting our own individual activities for a short period of time to support the collective well-being of the province. As I said, I understand the timing of these additional measures is not good as we enter this season. And the festive season is a time where many families and friends get together to visit, share meals, and socialize. And I think we can still enjoy some of these types of activities with some modifications. These measures are temporary and will be reevaluated, of course, every day, but will also be looked at in early January. We will continue to assess new evidence that emerges related to Omicron and will adjust these measures as necessary. As of Saturday, December 11th, 95% of island residents aged 12 and over have received at least one dose of vaccine, and 91.8% are fully vaccinated with 2 doses. 23.8% of children aged 5 to 11 have received their first dose. Over 9,700 people have received their 3rd dose or booster of COVID-19. And I mentioned it earlier, but just to highlight, there are over 7,500 island residents eligible for a booster that have not yet received their 3rd dose of vaccine. The early information about Omicron suggests that getting a booster helps to protect against severe illness. Some individuals and groups are at higher risk of severe outcomes from COVID-19. I strongly encourage people to get their booster doses, people age 50 and over, healthcare workers, and anyone who is moderately to severely immunocompromised. And you are eligible for a booster 6 months after your 2nd dose. And you can book an appointment online, as I mentioned, and you can do your booking of 4 to 6 weeks in advance or contact a participating pharmacy on the COVID-19 vaccine webpage. Omicron is going to be a challenge for all jurisdictions, including PEI. We will not be able to avoid spread of this variant in our province, and we can expect more cases and illness related to Omicron. We do not have a lot of lead time, and it feels like we are bracing for another hurricane. The measures announced today will help protect all islanders, especially those who are most vulnerable to severe outcomes from COVID-19. And we are also concerned about the need to protect our health system capacity, including public health capacity. Over the coming weeks, there is significant risk of COVID-19 transmission related to travel within the Atlantic region, elsewhere in Canada, and internationally. So now is not the time to travel if it is not necessary. And certainly in terms of discretionary off-island travel, whether we are able to postpone or pause it, I would encourage that. As I indicated last week, the situation with Omicron is evolving in Canada and around the world. Travel measures and restrictions can change quickly and with little notice. And although this situation is serious, it is important to remember that basic public health measures, including vaccination, are effective and provide important layers of protection against COVID-19. But we need to start acting now to minimize the importation and spread of Omicron. As we enter the next phase of this global pandemic, and it's one that is making every single one of us weary and tired of it, let us continue to support one another and continue to be patient and kind. Thank you. So I'll open it up to questions from the media. Would you like to go ahead, Dave Stewart from The Guardian?
Sure, absolutely. Thank you again, as always, Dr. Morrison, for taking our questions. There's been quite a bit of talk on social media with people wondering, as we've seen in Nova Scotia, the rapid tests are readily available in liquor stores and other retail outlets. Are we giving any consideration to making rapid tests that readily available here on PEI?
Yes, and so we have used some of our rapid antigen tests, as you know, through some of our programs in the schools related to outbreaks. We've made them available to access PEI for those, especially young children, for parents to pick them up. We're also using some of the antigen tests at our points of entry. So what we've talked about is trying to increase the testing access for everyone, and using them more as needed at the points of entry, and also to have them more accessible for everybody. Now we only have so many, and so so many come in a box at the moment, so we have to break them up, and there are people working to break them up into 2 at a time, so that they're because we can't give. If we give 25 to each person, then we won't have enough to distribute. And looking at how we can access more antigen tests, certainly. So we have not made a decision to put them in the liquor stores like Nova Scotia, but trying to figure out where we can best place them. So we talked about that this morning as well. And we've been, of course, talking to my colleagues in the Atlantic Canada over the last couple of days, but also with my colleagues across the country on Sunday. So we're all trying to make some of these adjustments.
And you mentioned the booster shot. Do you know what percentage of people 70 and above, or what percentage of long-term care residents have received the booster?
Yes, so I didn't bring all the breakdown in front of me, but we know that every resident in long-term care and community care has been offered the booster, and very high percentage. So we have very good coverage in long-term care and community care. It's high 90s in terms of, from my recollection of those numbers. In terms of overall, for those who are 80 and up, the last time I looked at it, I think it was over 50% of those had received their booster. I don't have the number for those over 70, but it's for some people who are in their 70s, they would just be reaching their 6-month mark, even the end of December, so they may be just starting to get boosted or be eligible for their booster. But we do track those numbers, and we are able to look at how many people were fully vaccinated by the middle of June, and know that that's how many people would be eligible for their vaccine at this stage.
And if I could just squeeze in one more question, there's, here we are, the Christmas season, and the Confederation Center has the Barra, McNeil's, Lenny, Gallant, Delta has a show. You talked about personal gatherings being reduced. Are you concerned about these events going forward? Have you talked to these organizers? Are these events not going to go forward? Give some people, obviously now there's a heightened concern.
Yes, and I do think there's a heightened concern. And to start with, we have not put in organized gathering limits, but we are really pleading with organizers and businesses and individuals to try to maximize the physical distancing, and as another layer, even with the Vax Pass events. And but at this point, we have not put that restriction in place, but masks are going to be worn at all times. And if we need to make an adjustment, we will. We're starting in a slightly different place than Nova Scotia and New Brunswick. I mean, Nova Scotia's had to go out 4 days in a row and talk about over 100 cases. New Brunswick, I think last I checked, had over 1,000 active cases. So we're in a slightly different situation. And we do more testing at our borders. So that's why we're able to do some adjustments for our internal measures. But at this point, it's really around trying to make sure you're vaccinated, wearing your mask at those organized events, and maintaining physical distancing wherever possible. And if we need to change that, we will.
I wanted to ask a little bit about travel over the holidays. I know this is a question we've asked you before, but it does seem like things are changing rather quickly at the moment. And as you mentioned during your briefing today, things like travel restrictions aren't out of the question. They could come back. What would the situation on PEI need to look like for, let's say, isolation requirements to come back into place for travel outside of the province?
And you're right, Brittany. We continue to get asked similar kinds of questions. I think we know we have vaccination. We know we are putting measures in place to try to limit that transmission. I think, and we're trying to really focus on areas where there's risk when you do come back. So no one is allowed to go into long-term care, as a visitor into long-term care, community care, and some of those settings. And I think, there could be isolation requirements at some point if we're feeling like that is the only way that we can achieve that, lowering that transmission. But at this point in time, it is really recommending that almost this modified isolation. So making sure that you don't have your test at the point of entry, go home, arrive here, go home and hug your family, and then find out that you've now potentially put them all at risk. So if you can wait until you get that, at least that first entry test, and then for the first at least 4 days at your home until you get a second test, you minimize some of the activities. I mean, going out to a big organized gathering or, spending a long time with elderly people or those who are really severely immunocompromised, it just might be safer to wait. So I think this is where we are comfortable at this point, looking at what's going around, and we're trying to balance it, and we've talked about that here before, Brittany. How do you balance the least amount of restrictions for the minimum time period, but still keep people safe? And we'll continue to try to work on that.
And I wanted to clarify that test on day 4. Is that still a recommendation for people traveling outside of the province but within Canada, or is that a requirement at this point?
It's a strong recommendation, and of course it's a requirement to get into some of the settings like long-term care, community care.
Okay. And one other thing you mentioned had to do with the resources the province has for things like contact tracing, things like the testing protocols we have in place. You said that those resources are stretched, they're strained at this point, and that there were alternatives that you were looking at when it came to contact tracing. Can you specify, or could you, I guess, give me any details about that?
So, I mean, a good example might be that, and we've in some ways started doing some of this approach over the last week, where we've been having so many more cases, or the last couple of weeks, where instead of me, the public health nurses, and the whole team calling every hockey player on a team, we may help with the coach's help, try to get that script or an email with information circulated to them, and to at least start that process. So I think that would be one example where we have to help each other get that message out. Some other provinces are almost looking at where some cases then have to do their own, tell their own contacts and contact their own contacts to give them information. But one thing that has worked really well for us is how well, I mean, public health nursing has done a really great job at doing contact tracing. And when we have situations and we know that they've identified so many people, and the subsequent cases we're getting are those who are already identified as being in isolation, we know they've done a really good job, and that has helped us. So it's really, but if we get so many cases like they're expecting in some provinces, how are we going to manage those additional cases? So we are talking about it, where we have not made any decisions, but wanting to, for all of us in the system, to figure out how can we adjust to a major demand that may come, but at the same time trying to minimize that impact. And that's what I'm hopefully we're going to do. And we have done it through every other wave here. And this may be, and likely by all modeling, be the worst wave. Now, and one of the teams said this may be the worst is yet to come, but that sounds. I don't want it to sound too dire, but I just think that it's coming quickly, and we don't know enough yet about the impacts of this Omicron variant, and in terms of its virulence and its ability to, in terms of how vaccines really can protect us against this particular variant.
And I just had a quick question about an incident that happened over the weekend. A group of people who were demonstrating against vaccine policies in the province. They were doing it in a residential neighborhood. I know that there have been other people who have spoken out about this to this point, and I was just wondering if there was anything that you wanted to say about that.
So I guess, Brittany, I would like to focus more on what some of the messaging today, but just to thank Islanders for the support that I understand was on some of the social media and also some of the support I received. So I'm, very thankful for that, and I know my family is too. So that's probably all I'll say for today.
Okay, thank you.
And so maybe I'll open it up to the phone lines. We'll see if they work any better today.
Gabrielle Drummond, Radio Canada.
Bonjour, Dr. Morrison. Ma première question, c'est au sujet du cas de ce premier cas du variant Omicron. Est-ce que vous pouvez nous dire en français qu'est-ce qu'on sait sur ce premier cas-là? Quelles sont les informations que vous pouvez nous donner? Et dans quelle mesure la découverte de ce cas vous préoccupe?
Alors, Gabrielle, bonjour. Alors, vous voulez savoir les mesures qu'on met en place, ou en particulier le cas du Omicron ici?
Oui, je voulais juste savoir précisément ce qu'on sait sur ce cas d'Omicron, s'il vous plaît, et dans quelle mesure la découverte de ces cas vous préoccupe.
OK. Alors, c'est un cas qui c'est lié au outbreak à Saint-Evex. Alors, c'est pas surprenant parce qu'on a déjà identifié, il y a des cas qui sont liés à Saint-Evex ici à l'île du Prince-Édouard. Alors qu'on a su que c'était Omicron identifié à Nouvelle-Écosse à Saint-Evex, c'est pas surprenant que nos cas ici vont 7 cas et puis peut-être les cas, il y a quelques cas qui vont être aussi identifiés comme Omicron, j'imagine, dans les prochains jours. Et puis, ce qui m'inquiète un peu, c'est que Omicron, ça double, le nombre de cas double dans 2,5 jours. On sait ici au pays que ça va assez vite. Alors, on veut limiter le nombre de cas qui viennent à l'île du Prince-Édouard et essayer d'identifier aussitôt que possible l'impact de ces cas quand ils arrivent ici.
Oui, et justement, pour freiner tout ça, vous avez dit que les gens qui arrivent ici, qui font un test à l'entrée de l'île du Prince-Édouard, devront attendre 2 heures avant d'aller dans les lieux publics ou même de voir leur famille. Mais si on prend un exemple de quelqu'un qui arrive par le pont de la Confédération et qu'on n'a pas eu le temps de le faire tester, puis on lui donne une trousse de dépistage rapide, quelle sera la consigne spécifique pour ces cas-là, pour les gens qui vont recevoir cette trousse rapide et qui vont la ramener à la maison?
Oui, dans ce cas, il devrait faire le test avant qu'il donne un grand câlin aux familles, au moins un, et puis il répète ça 24 heures plus tard. On ajoute des personnes pour travailler les dimanches parce que c'est tellement les dimanches qui sont occupés au pont. Alors, on va essayer de minimiser le nombre de personnes qui n'ont pas un test au point d'entrée.
Et ma toute dernière question pour vous, c'est au sujet de la 3e dose, parce que vous encouragez aux gens d'aller chercher leur 3e dose. Mais je viens de regarder que dans la clinique de Charlottetown, par exemple, de vaccination, il n'y a aucune plage d'horaire disponible pour le mois de décembre, ni pour le mois de janvier. Alors, comment vous entendez accélérer l'administration de la 3e dose? Est-ce qu'il va y avoir des cliniques de vaccination durant le temps des fêtes aussi?
La première partie que j'espère qu'on va parler au Health PI pour ces cliniques, il y a aussi les pharmacies, parce que vous pouvez en prendre les boosters, la 3e dose aux pharmacies, qui sont à plusieurs pharmacies. Alors, il y a d'autres manières, mais on va parler pour voir si on a s'il n'y en a pas d'opportunité d'en faire en décembre, janvier. On va essayer de discuter comment on peut avoir accès pour plus de troisième dose. C'est aussi c'est les mêmes infirmières des fois qui font aussi les enfants. Alors, ils sont en train de faire les troisièmes doses, mais aussi de s'occuper, d'essayer de vacciner les jeunes.
Oui, tout à fait. C'est bon. Merci beaucoup.
OK, merci.
Steve Bruce, CBC.
Hi there, Dr. Morrison. You were talking about our capacity to contact trace. I'm wondering about our capacity to test and how worried you are about that. If we start seeing a larger number of cases, how worried are you about our ability to test all the people that will require testing?
Well, I think it's a really good, fair question, Steve. At this point in time, I know that our testing, our testers and our lab have been stretched, but we certainly have had really good lab capacity up until this point. And I think it speaks to whether or not we need to use more antigen tests. And I think they're trying to use more across the country, recognizing that the sensitivity is not as good for the antigen tests, and that's whether you're symptomatic or asymptomatic. The sensitivity is not as good. We've been so fortunate in PEI through a lot of hard work by many people that the turnaround time has been really excellent, and our lab capacity has been maintained throughout this pandemic. But I think if we can do everything we can to prevent that kind of pressure on the testing and the testers, I think that will be important, and that's why we're putting these all these enhanced measures in place. I think we have more than just our public health system or hospital-based people doing testing. We have people at our points of entry also doing testing, and that will so we have others who can use ID Now machines. We have testing available 24 hours a day for in terms of our ID Now machines or our rapid testing in Borden for those coming through who are not symptomatic. So there's we have a range, so it's not like we're depending only on one testing clinic. We are also looking at ways to take pressure off the testing clinic, for instance, and I think this will be coming out later from the airport, certainly looking at options, looking at a way of doing some pre-departure testing. For instance, now it's a requirement to have a pre-departure test to go to the United States, and if we can arrange for that to be done elsewhere as opposed to the testing clinic, it means that those who need to travel to the U.S. or other places that don't require PCR tests do not need to go to the testing clinics. So we're constantly looking, Steve, at ways that we can prevent people from needing tests, from getting sick and needing tests, but also wanting to look at ways we can minimize the pressure on those testing clinics.
And what role do you see the at-home test kits playing? I know the opposition Greens put out a statement suggesting that if there was better access to the at-home kits, that would help ease the pressure at our testing clinics. What's your sense of that?
Well, I guess a couple of things. One, certainly as we get more have more access, we'll make them more accessible to everyone as well. I think there is, if you're using a test that is 49 to 53% sensitive on an asymptomatic person, it is can also provide a false sense of security for sometimes if people are doing that test and then think, well, they're fine, but half the time they're wrong. So I think there are limitations. I think they can be really an important adjunct to our testing, and we will need them as we go into this Omicron variant wave. And we're already using them, as you know, we've used them in schools, and we've used them for testing or vaccinate policies. We're using them at our points of entry when we can't test everyone. So I think we really are using them in various ways, and that will just be enhanced, and will continue to increase the access of those tests. But they come with limitations, and if you have symptoms and you can have a turnaround time of an important test and have access to a PCR test that we do here in this province, we should use that as opposed to antigen tests. But they will play an important role in this Omicron variant wave that is coming at us.
And how so? I mean, beyond the scenarios that you just listed where we're already using these tests, where do you see Islanders using them going forward?
Well, I think there may be some more routine testing that, for instance, we may get into a situation where if we could do routine testing for antigen testing before in certain workplaces, that may be, or high-risk work settings, that may be something other provinces have looked at and we may look at. I think we're going to always we're changing our testing requirements all the time. So, and if we are doing for instance, testing on day 4 for everyone, and we can't accommodate it at the testing clinics, and we have to use antigen tests there, and they can't access it, or you live in remote areas, and that's the test that you want to have access to for your day 4. That may be where we can try to complement what testing we're doing with the antigen test. So those would be a couple of places that come to mind, Steve, and how we continue to use antigen tests. But you can imagine the whole country is trying to access rapid antigen tests, and we are certainly have them from the federal supply and want to use them appropriately and in the right settings.
And a final question: I think there's the impression out there that there is an abundance of these at-home tests available across the country, and you look to Nova Scotia and you see them handing them out in liquor stores and at libraries. So is our supply here on PEI, per capita lower than it is in some other provinces, or what do you know about the supply that we have here right now?
No, I mean, we have access to the supply and our good access to our tests just like every other province, but we also have used our antigen tests for trying to get children back to school in outbreaks, so we are definitely using them in those. We have had hundreds of children now in the last few weeks try to use those antigen tests to get back to school. We're using our antigen tests at our points of entry when we need to at the bridge, and we have in PEI a really good turnaround time and access to testing that may not be the same in New Brunswick and Nova Scotia, so they may have to use some of those other things a little bit earlier than we've had to. But we definitely have been using our antigen tests and have a good supply, but just like every other province, it's limited in some ways, and we'll continue to look for more.
Okay, thank you so much.
You're welcome.
Julianne Lecasher, Radio Canada.
Bonjour, Dr. Morrison. Dr. Morrison, je voudrais savoir à quel point vous avez décidé de demander aux personnes qui rentrent dans la province de s'isoler en attendant d'avoir 1, 2, 3 résultats négatifs.
Bonjour Julien. Alors, je pense que j'ai essayé peut-être à répondre à ça à Brittany en anglais. Et puis, j'espère qu'on va pas aller pour isoler tout le monde, mais À ce moment, on vraiment discute un isolement modifié pour que vous avez un test en arrivant, vous avez un autre test à jour 4 et puis aussi avec symptômes. Et puis, entre ces deux tests, pas d'aller aux grandes sorties le soir ou aller pour faire les visites avec les personnes qui sont peut-être plus vieilles. Et puis c'est aussi, on ne peut pas entrer pour faire visite au foyer de longue durée, pour exemple. Alors, on commence avec ça. Et j'espère que ça va limiter le nombre de cas qu'on a ici à l'île du Prince-Édouard, parce qu'on veut vraiment préserver notre système de santé et on veut apprendre plus à propos de Omicron. Mais on veut aussi limiter, avoir une balance vraiment de limiter ce qu'on fait avec à ce point dans la pandémie.
Docteur Morrison, vous parlez des tests jour 1 et jour 4, de ne pas aller dans les résidences aux personnes âgées. Est-ce que vous pourriez élargir ça, par exemple? Est-ce que ça pourrait aussi aller dans les écoles? On sait qu'il y a beaucoup d'enfants qui ne sont pas encore vaccinés. Est-ce que les personnes qui reviennent dans la province pourraient attendre un deuxième test négatif avant de pouvoir aller dans une école?
C'est possible. À ce moment, les enfants doivent être testés avant de retourner à l'école. Et puis aussi, le jour 4, on n'a pas mis ça en mesure à ce point parce que l'école, c'est le dernier jour, vendredi, et vraiment, ces mesures commencent à ce point-là. Alors, mais si c'est quelque chose, peut-être qu'on va faire en janvier, mais on va voir.
Est-ce que vous êtes confiante, Dr Morrison, que les écoles vont rouvrir leurs portes en janvier à la date prévue?
Ces jours-ci, je ne sais pas si je suis confiante avec beaucoup, parce que ça change, le COVID-19, ça change tellement vite. Mais c'est possible que ça peut-être ça peut être retardé, l'ouvrement des écoles, mais ça va être décidé vraiment qu'est-ce qui arrive dans les prochaines 2-3 semaines.
Dernière question pour moi, Dr Morrison. Est-ce que vous avez des chiffres sur la 3e dose?
On a à ce moment plus de 9000, je pense que c'est 9700 personnes qui ont reçu une dose, la 3e dose, ici à l'île du Prince-Édouard, mais on attend, il y a 7500 personnes qui peut avoir la 3e dose qui n'ont pas eu encore. Alors, j'encourage toutes ces personnes à essayer d'en faire.
Merci beaucoup. Bonne journée à vous.
Bonne journée. And I think that's it. Thank you very much. Have a good day.